Mr Manure was always honest with me right from the beginning. He always made sure I would have the operation that would save my life.
I'm hoping that I'm not going to need it.
We spent about an hour together, and the empathy that he showed me in that time was more than anyone had ever shown me, any of the doctors that I'd been to, and he was very understanding and non-judgmental.
Basically, I felt great confidence in the man. I knew that he'd carried out hundreds of these procedures, and obviously you don't want to be an experiment.
I have been consultant surgeon for about 13 years now. I work both in the NHS hospitals and also private hospitals. I work at Homerton University Hospital, where I'm the Director of Bariatric Surgery, and also I work at Wellington Hospital, the London Clinic, Spire Roding Hospital at Redbridge, and the London Independent Hospital. I've been laparoscopic surgeon since its inception 20 years ago, and have been a bariatric surgeon also almost from its inception about 11 years ago.
Well, I decided I wanted to change my life and I needed something to help me to do that. So that's when I looked into the possibility of having weight loss surgery.
If I took my 80-year-old mum shopping, she was more sprightly and walking around the town than I was. And I thought there's something got to be better than this.
I'm diabetic and I was on insulin, which I was on twice a day.
The obesity is not just because they're overeating, because many people do eat but they don't put on weight. But a combination of the genetic factors or the genes they have, and also the environmental factor, which is the eating the wrong food. Bariatric surgery doesn't mean just getting rid of the obesity itself, but it also does resolve the conditions which are associated with obesity, mainly diabetes, blood pressure, sleep apnea, and joint problems.
The operation has been known to be really, really successful with people with diabetes because of making the stomach smaller. You're not having the sugar going through your body so much. And within 2 months I was off the insulin after having the operation. It was that fast.
When people lose their weight after the surgery, they develop a lot of confidence within themselves.
Before I had the operation, I just felt like I was in this vicious circle, and everything that I did was always down to how much I weighed. Where I went on holiday, where I went out to eat, what I did, who I socialised with.
It's lovely to go out and buy clothes, which is something I've never done. My husband took me for the first time to Primark in my life the other day.
I'm going to Barcelona for a weekend in a couple of weeks with all of my friends, which is something that I would never have done before.
I've really taken the bull by the horns and turned my life around.
And I was always thinking about, you know, when is my life going to start? Well, it started the day that I had this operation.
All the obesity or metabolic surgeries are now performed by a laparoscopic surgery, which is keyhole surgery. That means the patients get recovered within 2 days of the surgery, and most of them can go back to work if they want by 4th or 5th day. With gastric bypass, they lose about 70% of their excess weight, whereas with sleeve gastrectomy, they lose about 60% of their excess weight, and duodenal switch, 80% of their excess weight. Because I have done more than 1,000 cases of obesity surgery, I managed to reduce my operating time to 45 minutes for gastric bypass, 25 minutes for gastric band, and 30 minutes for sleeve gastrectomy, and therefore the patients recover very quickly.
I've lost 4 stone in 10 weeks, and my life has changed completely in that time.
Whereas now with my husband and my children, I can see a future. I can see myself, you know, getting old with my husband and one day having, you know, enjoying my grandchildren.
He's got a tremendous success rate, and I would think that if I was going to put my life in someone's hands, then Mr Manure would be the man that I would have chosen, and did.
My whole attitude to life has changed. I just feel like there's a light at the end of the tunnel.
I owe him my life.